Welcome to the Healthy Heart Show, where we pull back the curtain on conventional medicine and dive into the root causes of cardiovascular health. If you are concerned about high cholesterol, high blood pressure, heart attacks, stroke, or atrial fibrillation, this is the place for you. We will provide natural heart information that will help you prevent, treat, and reverse any ailment, leaving pills and procedures out of the picture. Here are your guides to holistic heart health, board-certified cardiologist and Amazon best-selling author, Dr. Jack Wolfson, and natural heart doctor, naturopathic physician, Dr. Lauren Lattanza. Hello, listeners, and welcome to another episode of the Healthy Heart Show. I am Dr. Lauren Lattanza, naturopathic doctor here at Natural Heart Doctor. I have an excellent guest for you today. I'm so thankful that she's here. Her name is Dr. Jessica Peatross, MD. Dr. Jess has a passion for uncovering the mystery behind the chronic illness, whether that be stealth infections, heavy metals, stress, trauma, or other environmental toxicities. She left her position as a board-certified internal medicine hospitalist and became trained in Gerson therapy, functional medicine, nutrigenomics, and ozone therapy. And through that, quickly uncovered that 90% of disease is a result of lifestyle, diet, and environment. As well as she discovered that the body has the answers to heal and reverse that chronic disease. She's known for her ability to help identify the root cause of illness, most oftenly traced back to hidden stealth infections like Lyme, parasites, and mold. Welcome, Dr. Jess.
Thank you so much, Dr. Lauren. I'm really honored to be here.
So glad to chat with you again. We met back in Boise and I got to pick your brain a little bit there. And I just know that our listeners are going to gain so much value from hearing more about you. If you don't already follow her, listen to what she has to put out there. I really suggest adding that and gaining all of her insight that we will start with here today. So I guess we'll just roll right into it.
Absolutely. Yeah, let's go.
So you talk like I just mentioned, going into some stealth infections. So how can some of these hidden infections cause cardiac issues, which are more specific to our listeners?
You know, I don't know how I missed this because, as when I was a hospitalist, I admitted, heart attacks and cardiac patients and all that stuff. And this never even popped in my mind because we just aren't taught this way. Mm-hmm. But once I got into functional medicine and I started to really say, what's this caused from? Oh, X. Well, what's X caused from? Oh, Y. When you keep digging, then where I ended up with some of these stealth infections for patients. And I've had young people, very young people actually have palpitations for no reason and have, supraventricular tachycardia or, irregular pulse rates and things like this for absolutely no reason. And then when you start to question other symptoms they have, they'll say yes to brain fog and bloating and joint pain and night sweats and shortness of breath. And you're like, wow, there's a bigger picture going on here. And I'll give an example to kind of round out the story about this. I have a personal patient who's only 35, and she literally got diagnosed with postural orthostatic tachycardic syndrome, which is a high pulse rate, low blood pressure. You feel like you might pass out, especially around heat. And then they went on to tell her after they looked at blood smear that she had hemolytic anemia. So shearing of red blood cells causing her anemia. They found a bunch of different weird shaped red blood cells like Burr cells, smudge cells, started talking about leukemia to this girl. She had Babesia. She had an intracellular parasite named Babesia that was literally shearing and damaging her red blood cells. And the heart was freaking out and palpating appropriately based on this self-infection. And we scared the life out of this poor girl. And with some getting to the root cause with some herbs and some really healthy interventions, she's back to her baseline now.
Yeah, I can imagine how scary that would be. And, I think that really maybe it is the palpitations that brought her into the hospital or some of these really scary things, but there are so many normal symptoms that just get swept under the rug. And that shouldn't be how patients feel all the time, this brain fog and some of these other symptoms, like you mentioned.
Absolutely. And I think a lot of the issue is we've segregated so much of medicine, and people are so busy. They all mean well, but they don't have time to look at the whole body and see where one system is causing failure of another, which is rolling into failure of another. And if we were able to look at the body as a bigger picture, a systemic vessel like it is and how it functions, I think we'd be more successful.
Right. And, in standard training, it's probably thinking that along the lines of parasites and babesia alone is, it's so rare. That's not what's going on with her.
Only if you're in a third world country, right? Unless you've traveled to Mexico or traveled to the Caribbean, it's not even a question on anyone's mind.
Right. Yeah. These little bugs, these critters do not see our international borders like we do.
Yeah, you guys, they're like, oh, US, we got deuces, we're out. That's not what happened.
U-turn.
And, honestly, we really don't have like the best food system in the United States anymore either. So it's not like we have first class healthy food that the citizens are eating anymore either.
Yeah. It's unfortunate. Yeah. I mean, we kind of just have to be our own advocates and find practitioners that we can trust.
Absolutely. So the moral of the story is don't let these parasites, don't pretend like they're not a thing, because they are a thing.
Yeah. And like you said, it's not directly attacking the heart. So it's not necessarily a heartworm that's doing this, but it's affecting your blood cells. So then your heart does downstream have that impact.
Yeah. It's appropriate for what it's seeing, right? Yeah.
Absolutely. So we had mentioned just now babesia. So usually like a tick-borne, is that right? Is that
usually? And I'll be honest though, not everyone obviously remembers a tick bite. They can be so tiny, like the size of a poppy seed. Who remembers that? But there's some really revealing studies out of Germany that show that you can get Lyme disease and co-infections from mosquitoes. And they've followed it all the way through the larva to the mosquito stage and proven it now in studies. So it makes you wonder.
Yeah, I know. And we're through the summer months, everybody's like, oh my gosh, I'm just covered in mosquito bites. And we think nothing of it. That's why we got to really take a good history. It's like, was there anything at all, like a really crazy bug bite? So we got to dig deeper and think maybe there was nothing, but it is something.
People think I don't have that bullseye rash, and like 60% of them never see it anyway. So word to the wise.
Yes, exactly. Not always textbook, as we come to learn.
Yes.
So let's talk now about maybe Bartonella. So how would Bartonella cause cardiac issues?
Bartonella is sneaky. It's a gram-negative bacteria, so it's not a parasite, but it's still a very stealthy and sneaky bacteria, and it likes to piggyback with other bacteria or parasites. They kind of work like frenemies a little bit, chipping away at the immune system together. That's what I like to call them. People remember that well. Bartonella, yeah, you won't forget it, right? They're frenemies. Everyone knows what that is. Yeah. So Bartonella actually works by getting inside a precursor, a white blood cell precursor that then travels, and its final location is the endothelium inside the blood vessels. So Bartonella takes up residence in this white blood cell precursor and is actually delivered to its exact site that it wants to be at in the blood vessels by our body's natural way it's forming the endothelium, or the inside layer of the blood vessels. And when that happens, you have a pathogen that's literally inside the inner layer of your blood vessels. So the blood doesn't flow right. There's a lot of turbulence in the blood vessels. There's a lot of stress. There's a lot of inflammation there. And so the body sees the problem in these certain areas. And really, we think our bodies are wrong, or there's something wrong with us, but your body's always protecting you. And so if this bacteria gets inside the blood cells and your heart starts going crazy and you start being diagnosed with these weird terms that doctors use. Yeah. There's nothing wrong. The real problem is usually there's something stuck inside the circulatory system that doesn't belong there, and the body is seeing it. And so Bartonella is super sneaky and stealthy. That way it almost Trojan horses in.
Wow. That is sneaky. So, and I know that we run myeloperoxidase on labs. Is that potentially something that you would see on this vascular inflammation? Okay.
Absolutely. Gosh, there's lots of things you can look at. I think Bartonella and Babesia both are really hard to get positive reads on, especially, as you know, with regular conventional blood work that hasn't changed in 30 to 50 years.
Right.
If these things are buried in tissues, they're not hanging out in the bloodstream. Our body's immune cells would see them and say, attack, kill, kill, kill. But these bugs are so smart. They're almost as old as we are. They're very stealthy. And so they get inside tissues and they hide. And so really the body has a difficult time removing these things and seeing all of the problem. And so that's really, I want people to understand their body is always working for them, even if it feels like it's not.
Yeah. And like I would say, we kind of have to just get out of our own way because our body's trying to do its best. And then we're constantly providing more and more toxic substances and potentially more microbes that are hindering all the time.
Absolutely.
So outside of maybe some bug bites, where are some other common places that people might acquire these types of infections?
So with Babesia, Bartonella, especially, let's go with parasites first. Yes. So under the category of Babesia, some parasites you can see, some are intracellular and microscopic, like Babesia is. We think 30 to 50% are microscopic. You can't see them anyway. So where do we get parasites? That's a great question. Most people think third world countries immediately, and that is one place. But, you know, the United States doesn't have the cleanest tap water and drinking water these days. You could actually get H. pylori from the water supplies. And so we think parasites are right in there with that, unfortunately, as well. So really getting educated on clean water, filtered water, distilled water, whatever is right for you and your family can be a protective mechanism against this parasite. Some other places, animals. I hate saying this so much. It pains me to say that dog kisses can give you parasites, but it can. So careful. I can't even tell you. I have a friend from back home whose husband was just in the hospital, first confirmed, quote unquote, case of Rocky Mountain spotted fever, which is another co-infection of Lyme. Yeah. And the dog ended up having it and dying from it 2 months later. So these things absolutely can be passed back and forth between humans and their pets. And it's kind of like what came first, the chicken or the egg. Yes. So you really want to, right? You really want to be careful about letting animals, especially animals you don't know or haven't been dewormed, licking you in the face. Another place are cat litter boxes. Toxoplasmosis is a parasite that can come from cat litter boxes, which is why we tell pregnant women not to clean them when they're pregnant. Right. So a little, you know, it could really hurt the baby. So these are some of the places. Contaminated food is another place we can get it. So, and honestly, we don't fully understand the relationship and ecosystem of all these parasites and bacteria to each other. We know they talk through quorum sensing across species. So even in family groups, it's really hard to know what exactly we're sharing in a household.
Can you elaborate just briefly on quorum sensing? I love that.
It's pretty fascinating, actually. So I first found out about quorum sensing in like a Discovery show where I was watching the bottom dwellers at the very bottom of the ocean, and they light up in unison. All the squid and those clear jelly-like things down at the bottom of the ocean that can light up in aqua and turquoise and pink colors. That's because of the bacteria that inhabits all of those different bottom dwellers. And they have a system where they are actually able to talk and light up at the same time. And it's a very symbiotic relationship. What we know now is that certain bacteria, certain viruses, certain parasites as well, actually form biofilms inside of bodies, and they talk and they communicate to know how to do this. And biofilm is like pond scum. It's literally the stuff that's on your teeth in the morning, like slimy stuff. So your body can't see through that stuff. Your white blood cells really have a hard time. It's almost like an abscess. It's walled off and your body can't penetrate it. And once the bacteria form this biofilm, it's like a colony of them all talking together in this gooey biofilm that your body can't see. Causes real problems, right? And what we know now from the biofilms is they're actually able to epigenetically turn genes on or off based on these certain biofilms. It's absolutely amazing. It's how bacteria communicate. It's how they hide from us. It's how they form gangs and frenemies. And so we think we don't really fully understand the communication in this and what it can mean for households.
Yeah, what we don't know is a lot. And it's just a good reminder to all of us that we are so not sterile. Like,
Yes.
you can have the best hygiene in the world, but you still have a lot of bugs and a lot of things interplaying in your human biology that is not human.
Yes.
Um,
100%.
yeah. So, okay. So, where might some of these bacterial or otherwise infections outside of the parasites, sorry.
Oh, outside of the parasites,
Right.
yes. So, really unclean water, dirty food, contaminated food,
Yeah.
all of these things really play a part in transference of bacteria, viruses, parasites. All these things are a risk for most of the bugs. I will say, however, I hold a certain viewpoint that a dirty terrain makes a dirty germ.
Mm-hmm.
And what do I mean by that? I mean, the more poisoned, literally poisoned your body is, or full of toxic corporate man-made junk, petroleum, plastics, pesticides, yada, yada, the list goes on.
Right.
80,000 chemicals that are unregulated, right? So the more of those you have in your body, it's like your toxin bucket fills up. And I don't blame the microbe. The microbe, such as the bacteria, let's say Bartonella, why is it there? Well, do you have a toxin inside your circulatory system that it's there to decompose? Because bacteria are the great decomposers. They're there because they're eating something that shouldn't be in the body, is what we're starting to believe. Viruses also have chemical communication in the body. They work by cleaning up cellular debris. Fungus also, right? They eat bacteria. It's a big ecosystem.
Yep.
And so let's take a different perspective here. How do you get these pathogens? Well, you can get them from contaminated food, water, pets, third world countries. There's many places you can get this stuff, but why are you getting it? Because not everyone gets it. Why? That's the real question for me. And the answer, in my professional opinion, and it's just my opinion right now, there's some evidence, but right, nothing's set in stone, is that the more toxic you are, the higher your chances are of attracting a bacterial, parasitic, viral invasion because they're there to clean up.
Right. Right. Like you mentioned, the toxic burden, toxic bucket. How full is your bucket? If you're already up to the brim and you come into some sort of infection, your body's going to have a lot more to work against to clear that. Absolutely.
100%.
And when we talk about parasites, I feel like whenever I mention that to patients or whenever I mention it in passing, it's kind of like, no, well, I don't have a tapeworm. Like, I'm not talking about a tapeworm. Like you said, so many are microscopic.
Yes, exactly. People do think of these crazy parasites that like you would just know if they were there, and it's not the case.
Right. Yeah. I don't think that you're going to always be this muscle wasting patient that has a large tapeworm. But there are so many variations in that we have to kind of keep on our radar. And that just because we're not a third world country, we can't dismiss. The Healthy Heart Show will be right back after we take this quick break to hear from our sponsor. Would you like to drink great tasting coffee that's also good for your heart health? Cardiology Coffee is your answer. This 5-star rated coffee is delicious. It's a gourmet coffee that begins with whole organic beans, hand-selected and carefully roasted. It's tested and certified to be free of pesticides, mold, and other toxins. Cardiology Coffee is great for your heart, and you're going to love how it tastes. Order now online at cardiologycoffee.com. Now back to the Healthy Heart Show.
Yes.
So would you compile mold into this as well?
So mold is more of a, I think of mold as like a chemical warfare agent, actually. Is it biologic? Yes. Is it natural on Earth? Yes. Mold grows everywhere on Earth. But why is it so detrimental to humans in modern society if it's meant to be on Earth? It is a lot of our modern day building practices and a lot of our lifestyle choices at this point. And yeah, mold is also, I consider it more of a toxin than a pathogen, although because it lowers immune systems so much, it is kind of the igniter of other disease or the causative agent for why you would be a hospitable vessel to other pathogens or microbes.
Yeah, that makes good sense. Yes. Again, we don't live in a bubble. We're going to come into contact with it. But if we get in these certain kinds, then we do have the mycotoxin. So it's not even just the microbe, So toxins from that microbe, and then they recirculate, and is your body clearing it, and all of the things.
Yes, absolutely. With mold and a lot of bacteria, right? Gram-negative bacteria, they have these endotoxins they produce. So sometimes, a lot of times, it's not even the microbe making us sick; it's the byproduct of them digesting and eating things away. Mycotoxins are competing for food a lot of times. So they produce these basically volatile organic compounds that damage our DNA called mycotoxins.
Yeah,
It's literally a warfare agent.
that's nuts.
Yeah.
So what would some maybe some characteristic signs that people should look out for be if they're thinking, mate, you know what, I've had some mold that I've since taken care of, or maybe they haven't yet, or I ate some questionable sushi. What should people be kind of on the lookout for?
Sushi. Thank you for saying that. I forgot. I should have named that in the food category for parasites. Yeah, you guys, they still love sushi. They can't. I know too much now. I'm like, no fun at all. So with mold or parasites, so some of these symptoms kind of overlap. I'm going to try and tease out some individual ones for each one so people can know, but I'll tell you the ones that overlap. And because these things run together, guys, they don't run alone usually.
Right.
So with mold or mycotoxin illness, you'll see a lot of people with mold specifically have these weird pins and needles sensations on their extremities. And it's literally from neuropathy from mitochondrial damage, like people who get chemotherapy and have that type of symptom. That's the same process. And people will literally not be able to hold their urine at night. You'll see children start bedwetting again that were potty trained. You'll see adults have to get up multiple times, sometimes at night, to relieve themselves because mold inhibits anti-diuretic hormone. Now, anti-diuretic hormone means you hold on to fluids. So if you inhibit it, you're peeing, peeing, peeing. It's what is inhibited when you drink alcohol. It's the same process that way. People with mold, it's actually an immune process in the brain that spins the immune system out. So they have a lot of sequela from that. They start having insomnia because there's less melatonin production. They start having pain sometimes and inflammation because there's endorphin production. Their immune system kind of goes haywire. So they get staph infections in the nose. They get lots of other candida is mold's little dirty cousin that likes to hang out and play. And so these things are kind of a common occurrence with mold illness. The more classic symptoms are, itchy, runny eyes and nose, sneezing, shortness of breath, which parasites can cause too. You may even have some weight gain where it inhibits leptin and destroys leptin cells in the brain, and the body's natural responses to increase the receptors. And that causes weight gain on like 500 calories a day for some people. So yeah, it sucks. Women really love that last one.
Oh, yeah.
And then parasites, some things they make people do that are unique to them. People will grind their teeth at night. A lot of times people have teeth issues like root canals that are infected or mercury fillings, and parasites love to inhabit those teeth. And so your body's natural defense is to clench when they're moving around at night because they're nocturnal. A lot of TMJ, clicking jaws, sore jaws. That's one thing to look for. Another thing unique to parasites is worse around the full moons. And that's because there's a big full moon.
Yeah.
So you produce less melatonin, more serotonin, which is kind of parasite party food that makes them mobile at night, which is more stress in the body, more clenching. You may have anxiety and insomnia around full moons. Rectal itching is another super sexy trait that comes with them. Even dairy sensitivity. Or lactose intolerance can be, especially strongyloides are some of the bigger parasites causing issues. And then a lot of skin rashes come with both mold and parasites, eczema, hives, psoriasis. All of these are very, very common if you've got parasites under the skin in the fascia, or mold, which also really the body's just trying to push those mold spores out.
Wow. Awesome. Okay. Thank you. That's very elaborate. And even with affecting the hormones and oh my gosh, so much great information. Yes. So would you expect some of these symptoms to worsen as you're clearing some of these, be it molds or parasites?
Yeah, because honestly, remember, if we're right about the toxin overload, we're not just mobilizing the microbes, we're mobilizing whatever toxin is there that attracted them in the first place. So yeah, and the biggest problem I see with this, if you have fat loving or what we call fat soluble toxins, when you start to lose weight and actually get into the nitty gritty of the detox that most of us want, you may feel worse because you're liberating those toxins from the adipose tissue. And certain people really feel that.
Yeah. Yeah. I that's what I tell patients often is that, everybody wants to detox. Oh, it's new year, new me. I'm going to detox. But it kind of feels like trash. It's not always glamorous.
To say the least. Yeah. Nope, not at all.
Yeah. So, and that's where, so then we can kind of talk about, I think what you have is a really actionable item that is great for people to hear and understand. Kill, bind, sweat. I'll let you go ahead and elaborate on that.
Yeah, I was telling Dr. Lauren before we hopped on that and started recording that it sounds like I'm like an S&M doctor. It sounds like super dangerous maybe, or sexy. No one's really sure. But I think it just kind of caught on. And I think it's because the title is catchy. And like you said, it's a very practical step that people can take. They understand it.
Mm-hmm.
And so let me just take a moment to explain. This is a protocol that I wouldn't have people start on if they're really, really sick. It's kind of the second tier protocol for people. So once you know that you are pooping okay, you're sleeping okay, you have pretty good energy, you don't feel like trash all day long, hey, your detox pathways or drainage pathways are pretty open. And I mean your bowels, your liver, your sweat, lymph, all of those. If I were to do kill, bind, sweat with you, without doing that first, you would not like me anymore. We would not be friends. Y'all wouldn't want to talk to me. So I always try and prep the patient beforehand. So don't jump right into this right away before you prep your body properly. That's the disclaimer. Now, kill, bind, sweat, kill means you're taking, I prefer an herbal antimicrobial, or something, if you're doing something for candida, maybe you do nystatin, something like that, very mild, or, some herbs, oil of oregano, cloves. I use a lot of different killers for this, berberine, there's so many things.
Right.
Then you want to wait about 20 minutes, take a binder of your choice. I really love Cellcore's binders because I think they're the best on the market. They cross the blood-brain barrier. They don't just stay in the gut. So I really love their binders. So I usually have them take one of those because it's also not going to strip your nutrition like cholestyramine. It's actually going to add nutrition. And then you get in a sauna or have a really nice, hot, sweaty workout. And what this process is trying to emulate is killing a pathogen that shouldn't be there, something that's in your body that's overloading it. Then we take a binder to mop up the toxins that we just killed, which make you feel pretty crummy, and then sweat that out of the body. We don't want that staying in the body and recirculating throughout the enterohepatic system.
Right. Awesome. Love it. Yeah. And Cellcore, I couldn't agree more. It's actually goes more systemic, and it's not just binding up what's in the gut. Because we know, like you mentioned with skin and everything else, it ends up everywhere, and cleaning up
everywhere,
the muck in the brain and all kinds of stuff. So yeah, great. Kill, bind, sweat, not S&M.
No, I guess y'all could take it there somehow, but yeah.
All right. Well, so where can our listeners learn a little bit more about you and learn more about Kill, Bind, Sweat and some of your other, wonderful information that you put out to all of us?
So I have tiers, or a hierarchy to how much you guys want to be involved. If you like free information, stellar. I like giving information to people and teaching because not everyone has the luxury to be able to afford things. So very active on social media. For those reasons, I'm starting to hate it. So I don't know how much more I'll be on it, to be honest with you guys, because I'm not able to speak freely. Yeah, but I love to teach the general populace that's interested. It's so fun. So I do a lot of free stuff on there, you guys. Go check it out. If you'd rather read blogs and get a bigger picture, a bigger story, I have drjessmd.com. There's a bunch of blogs on parasites there and mold there, a lot of stuff we talked about, a lot about Epstein-Barr and even H. pylori, and then environmental toxicities in general and how to heal yourself. If you guys want even more, where you kind of interact with me. I answer your questions on a community forum. You can write in and I do a root cause quickie for you on a certain condition. We have, bi-monthly webinars where I spend 2 hours talking to you guys and answering questions. So if that's more your speed, that's Wellness Plus. That's my subscription app on my website, and that's app.drjessmd.com. There's a lot of different packages there. If you just want to try it out for a month, it's $49.
Cool. I love it. Awesome. So many great resources. And then, I wanted to ask you one other question that I get a lot, which is on the topic of mold, is house plants. What is your idea about house plants?
This is a great question. And you may have gotten me, Dr. Lauren, because I don't know if I have a definitive answer for you on this. I think that there are certain plants which are prone to that and can carry spores around on them for sure. So are you asking specifically, should you take houseplants with you when you've lived in a water damaged house? Is that what you're asking?
No, just like patients that have them are like, oh, I love the plants in my home. Do I have to get rid of them?
No, I don't think so. But, there are certain, I think you have to be careful if you've lived in a water damaged home, and because the spores, they hang in the air and they really like to go bury into porous things like chairs, couches, mattresses, books. You can kind of clean it. Plants, you can kind of clean too. Mm-hmm. And so I think most people, unless they're extremely sensitive, are okay with plants for the most part. Now, if you had an arrhythmia score probably above like 12 or 14 and you have the sensitive genes for mold, I would be really careful even with plants.
Right. Because sometimes that bucket is smaller and the threshold is kind of low. Awesome.
Those people, I was just going to say, they don't have their genotype. They're made to smell or the problem immediately when they walk into a building that's a problem. Your body reminds you immediately, this isn't good. I feel dizzy. I feel weird. And there's nothing wrong with you. It's saying, get the hell out of there. You can't handle it because the way your genes work, they don't recognize a certain pathogen protein to be able to bind to it and get rid of it like other genotypes.
Right. Right. Kind of the canary in a coal mine. It's not a bad thing. It's just heightened sensitivity.
No, thank you guys. One day I'll just be sick and not know it. You guys help me know what's toxic for us.
Yeah, exactly. Send them in the building and like, should I live here or no?
No, they say no.
Probably not. And one final question for you that I like to ask all of our people that join us on the show is, how do you live a heart healthy lifestyle?
I love that. I guess my favorite thing in the world to do every day that makes me feel great is move my body. And I think if you have a body, it's such a privilege. If you have a healthy body, what an honor. I think that it's almost like church to move your body. It's a celebration and a worship of what the vessel that always works for you. And so I never want to take that for granted. I know how healthy that is for my heart and my circulatory system. I know how great it makes me feel and raises my mood. I wish everyone on the planet would move their body and sweat every day.
I couldn't agree more. Like you said, it is such a blessing that we have the ability and we're able to do that. So use what you got. Awesome. Yes. Well, thank you so much for joining us today. I'm going to post all of the information about where people can follow you, both social media, your wellness with Dr. Jess, and so that people can connect with you on a more one-on-one level as well. And hopefully maybe we'll have you back on the show because you've got so much wonderful information to put out there to our listeners, and they should absolutely have an access to this. So I sincerely appreciate it. And hopefully we will be talking again soon.
Yeah, I'd be honored. Thank you. Thank you.
Thank you so much. And that wraps up another episode of the Healthy Heart Show. Thank you for listening. That does it for today's episode. Thanks so much for listening to the Healthy Heart Show. Please help us get the word out by liking and subscribing to our podcast and our Facebook page, Natural Heart Doctor. Please show support for our podcast sponsor, Cardiology Coffee, your resource for organic, antioxidant-rich, mold and pesticide-free coffee shipped straight to your door. Learn more by adding @Cardiology Coffee on Instagram and visiting cardiologycoffee.com. This podcast provides materials for information and educational purposes only and should not be considered medical advice. We encourage you to contact your physician for any of the health issues discussed here.